And welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a couple different procedures today. We talked arm lifts before. Now we are talking liposuction. Of course, any advice we give you today, you want to consult your own physician first. All right, liposuction. Summer's upon us, Dr. Mealy. A lot of people coming in, getting liposuction, got to look good by the pool, whatever. Is that happening now?
It
Who's
does,
a good candidate?
because the advantage with the liposuction is if there's a problem area that just doesn't
go away,
you can pick where it leaves from.
Yes.
And as long as it's fat, I think it works very effectively. Again, like we talked about with the arms, the skin needs to be tight enough so that we get that recoil, that normal recoil of the skin.
Yeah.
But it's different than weight loss. You know, with weight loss, our genes tell us where the fat goes and when it leaves. And there's some folks where it just all goes to one place, and the rest of their body looks very fit and appropriate. And there's the one spot or two spots that just don't go away. And liposuction provides us a way to get rid of those problem areas.
So there are better candidates. You don't want to come in after you've had massive, you need massive weight loss for liposuction.
No, it's not a cure for obesity.
Okay.
So if someone's very overweight, even if I remove the maximum amount, which we voluntarily limit that to about 5 liters, about 10 or 11 pounds. So if someone's 100 pounds overweight and we remove 10 pounds, they're still 90 pounds overweight. I'm not really helping.
Yeah.
It's better for the folks who are closer to their ideal weight that have those problem areas that don't want to go away. Now, if someone's 100 pounds overweight, bariatric surgery might be a better choice if dieting and exercise is not doing enough.
And then come in and tighten the skin up. All right, let's go to some before and after photos, please. Okay. First one right here. Oh, that's not.
So this is liposuction. Again, the hips were a little bit wide. There was a problem in jeans and tighter pants. Yep. So we call that the saddle
always
bag.
have. Oh yeah.
And then between the legs too, there's another pocket where we tend to have a little fullness, and it's compounded by the fact that the muscles, the shorter muscles, kind of stack up in that area too.
Oh really?
So there's a natural tendency to have a little more fullness at the top of the leg.
Oh.
But this again, we get to go after those little spots that may not.
That's great.
Yeah, may not.
God, the inner thighs look really good.
Yeah, it opens that area up, and I can't always do that. It kind of depends on the anatomy.
Yeah.
But in this case, since it was due to a pocket of fat, liposuction gets rid of fat.
Where are the scars?
So the scars may be up in the gluteal fold, so into that fold underneath the butt.
Very nice.
Sometimes I'll put some down by the knee if we're working near the knee.
Okay, and it's not a line scar, are they just?
That's about a ½ inch, ¼ inch long.
Very small.
And the way we do it now is we make an incision, put a little straw in through the hole, and then put the cannula through the straw so we're not rubbing the edge of the skin.
Oh, okay.
And it tends to heal within a week or two.
Bruise as much.
Really quick.
This is
This is a guy with gynecomastia that's kind of pseudo-gynecomastia, mostly fat. So I'm able to go in through a little incision up in the armpit and just vacuum that out.
That's a great result too. So
he was in good shape before.
He's in great shape, but
so
he just had a little too much fat.
He gets full credit for that.
Oh, really?
I just do a little part, just take away that little bit of extra, and it really helps. And the nice thing is it's very discreet. You can't tell that I was there.
You can't tell a thing. So what's downtime for, I know there's different procedures, but what's your usual downtime?
Liposuction is kind of like a muscle ache soreness. So most people, a couple days down, by the end of the week, are feeling fine.
Oh, good.
And again, there's a garment involved just to give it a little compression there. So here's someone with just, the fat just wants to go right under her belly button.
Wow. That is a great result,
too. And there was a little bit on the flank, too, a little bit on the back.
How old was this person, do you know?
I think she was in her 40s.
Oh, okay, so it looks like the skin really bounced back nicely on that stomach.
Yeah, it did very, very well.
Oh, so no loose skin after that.
Obviously, again, good shape, not tremendously overweight at all.
Exactly.
In really good shape. Right.
Perfect candidate. Now, what about freezing? They're talking about liposuction, the freezing liposuction. Is that a gimmick? What's going on there? Or is that good?
It does show some benefit, but it doesn't tend to be as dramatic or as consistent.
Okay.
And the nice thing about liposuction, it's been around a long time.
It's been around a while.
We kind of know who's a good candidate, who's not a good candidate.
Right.
And we can tell people, in one treatment, this is likely what we'll get as a result.
You can see just by telling.
So see her belly looks kind of round before.
Yeah.
And again, we've taken out that extra fat. In this case, I think she's lost additional weight on her own.
Yeah, because
which makes it look even better.
It looks great.
But a lot of times it's motivating. People get rid of that bulge that's bugging them, and now they take care of everything else.
And her skin wasn't really hanging. Here's another before and after where you've got a little more belly skin.
Yeah, a little bit extra there. You might think that's going to collapse as we deflate it, but she had good skin tone, thick skin, very healthy skin.
Fantastic.
And it just gets rid of that bulge.
And so the scars on that procedure would be where?
So scars are usually down in the groin. So I'll put it down.
Okay.
I used to put it where people have hair, but no one has hair there anymore.
Yeah.
We'd put it right in the corners of that hair.
Do we have a before and after for that?
No, okay. I can't show those. The Cron 4 thing is over. But yeah, we're just trying to hide them. You know, even though they're small, you can kind of put them any place you need them.
Okay.
And I think it's better to put an extra scar here and there to get rid of the fat rather than leave the fat. But usually we can put them down and out of the way. And the advantage of the liposuction is it's a long cannula, so you can get around corners, you can get into that area from farther away and still get a nice result.
Speaking of that long cannula, has it changed liposuction, you know, years ago as to now? Is it better, easier?
I mean, the original liposuction used sharp cannulas. They were rather large, and they caused a lot of blood loss. So after about a liter, liter and a half, you had to transfuse someone. Newer techniques with the tumescent, put some fluid in there before, makes it more comfortable, recovery's faster, less bruising, less bleeding, much safer.
Not as much downtime and less bruising.
Yes.
Sounds good. All right. For more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web, either drmealy.com or sanfranciscobreast.com. Lots more to come on Body Beautiful, talking about plastic surgery. Keep it right here. We will be right back.